Assemblywoman Vanessa Gibson. I represent the 77th District in Bronx County, which includes the communities of Claremont, Concourse, Highbridge, Mount Eden, and Morris Heights, most of the Southwest Bronx. And I want to talk about healthier eating. In the borough of the Bronx, we face the dubious distinction of being the poorest borough, the borough that has the most unhealthy residents, and we face a major problem that's plaguing our children, and that problem is childhood obesity. In my borough, in my community, we have a lot of children that are eating unhealthy food, and we're really trying to target better ways to live and more nutritious food and fruits that can help sustain and build and strengthen our families and our community. One of the things that I am doing as a legislator is working with many of our local nonprofit organizations, working with some of our healthcare organizations in my community to host workshops on healthier living practices and bringing in nutritionists and dietitians to make sure that we can encourage and promote better ways to eat healthy. One of the challenges that are facing many of our families in this community is two things. I call them the two A's: access and affordability. It's extremely difficult to ask families to make better decisions in the foods that they prepare for their children when they cannot get to the local supermarket that has the healthy food and the healthy fruits. It's really difficult to ask families to take on a financial burden when they simply do not have the ability to purchase a lot of these foods that we know are much more healthy for them. So what are we doing to target the two A's, access and affordability? We're doing it on a number of different levels. We're collaborating with nonprofits, with our faith-based organizations in our churches, and we're also going into our schools. In my community, we have school-based health centers, and we have doctors, we have nurse practitioners, we have social workers that are working with our children on a daily basis to help them, to make sure that they make different choices. Why do we do that? Because we recognize that families and children must learn together. The decisions that our parents are making are affecting the longevity of our children, and we have to do something because this is something that is breaking at the fabric of our communities. The borough president, myself, many of our community political leaders, my colleagues in government, we have been a part of forums that talk about healthy living and healthy foods, but we have to do more. That is certainly not enough. We have to continue to go into our communities, talk to our families, talk to our parents, go to them where they shop, where they work, where they live, where they play. We have to be creative because the reality is our children deserve better, and we want them to live longer, and we want them to be healthy. We certainly do not want a community, as we have seen in the past, where we have childhood obesity and we have children that are taking medications every single day just to live. And that's what we have now. So working together with our nonprofit organizations, with our community groups, we have to make sure that we equip our parents with the necessary resources that they need to get access and affordability. It starts right at home, it starts right in your kitchen, and we can do that because we can really make a difference. So I, as the legislator representing the 77th District, will continue to work with Morris Heights Health Center, with Bronx Lebanon Hospital, with my churches, with my schools, with my parent advocates, with my leaders, to make sure that health is always the number one priority. This is about longevity. This is about continuing on the investment and making sure that our children and families have access to what they need. And this is ultimately about sending a message that we cannot and we will not tolerate unhealthy living practices in our community. We have to send a message, regardless of what is in our community with our fast food restaurants and some of our other businesses. We have to send a message that our children and our families deserve better. I have had the wonderful opportunity in the course of my being in elective office of working with a phenomenal nonprofit community organization right here in the Bronx called Each One Help Two. Their vision and their purpose is really about helping everyone, using resources and programs to allow families and children to live healthier lives. They have formed relationships and partnerships with personal trainers, with nutritionists, and really have a focus on going directly into the home, which is where everything starts. If we want children, if we want families to make better decisions on healthy foods, fruits and vegetables, then we have to start right at home. And Each One Help To has been going directly into homes, changing the nature of how they prepare food, of what types of food they prepare, even down to taking families food shopping, because we recognize that in the Bronx we have a great diversity of families and different cultures, and we know that many of our families have a particular pattern of certain foods that they prepare and certain ingredients that they use. What Each One Help To is trying to do and attempting to do is identify better ways in which we can live and eat healthier, down to the foods that we buy, down to the ingredients that we use, because this is really about sending that loud message that we want our families to live healthier. And if we can start right at home in changing the behavior of how food is prepared, then we know that that message can really resound throughout our community, throughout our families, and throughout our neighborhoods. So I'm so proud of the work that Each One Help To is doing, and certainly look forward to being a partner and an advocate in working with them to really make a difference in the lives of our children and families in all of Bronx County.